Hello, Bermuda. The following is a message for Bermuda's parents and guardians from the Ministry of Health's Child Care Regulation Program. Choosing the right daycare provider for your child can be a daunting task. There are so many questions. The most common one is usually, how do I know if the provider I pick is safe and actually going to provide a solid early childhood foundation for my child? There are a couple of things you should look out for to ensure that your child is in good hands and adequately prepared for their school years. First of all, they should be registered with us. Daycare providers should have a certificate of registration, and daycare centers must have a license. Both must be displayed where parents can see them in the provider's home or the daycare center. If you do not see these documents on display, just ask to see them and be sure to check the date. You can also visit the below link to see an up-to-date list of all providers and centers registered with the Child Care Regulation Program. If your provider is not on the list, you should encourage them to register with the Child Care Regulation Program. If they do not, you should consider moving your child to a registered daycare provider or licensed daycare center. Another thing to keep in mind is that daycare providers are only allowed a maximum of 3 children under their care, which includes their own children or grandchildren. Daycare centers must comply with specific staff-to-child ratios, which depend on the ages of the children. These numbers are one way to support a safer environment for our children. You can find out more about the ratios and the child care standards on our website. You can contact our compliance and support section directly at childcare@gov.bm or call 278-4900 with all questions regarding child care in Bermuda. At the Child Care Regulation Program, your child's well-being is our main concern. This message was brought to you by the Department of Health.
Good evening, Bermuda, and welcome to the members of the media who joined us here this evening. I'm joined today by the Minister of Health, the Honorable Kim Wilson, who will be providing an update to the public on the coronavirus and other matters from the Ministry of Health. Following that, I'll give an update on matters related to our economy and also regarding the throne speech that will take place on Friday. First, the Minister of Health. Minister?
Thank you, Premier. Good afternoon, everyone. There were 722 test results received by the Ministry of Health yesterday, and none were positive for COVID-19. Bermuda has had 206 total confirmed positive cases, and their status is as follows. There are 21 active cases. All are imported, consisting of 8 visitors and 13 returning residents, who are all under public health monitoring, and none are hospitalized or in critical care. A total of 176 have recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 54, and the age range of all of our positive cases is from 7 to 101 years. The average age of all deceased cases is 74, and the age range is 57 to 91 years. The source of all cases is as follows. 95 are imported, 90 are local transmission with a known contact, 21 are local transmission with an unknown contact, and none are under investigation. Bermuda's country status remains at sporadic cases, and the 7-day average of our real-time reproductive number is less than 1. Yesterday, I advised the public via a press release that on the 1st of November 2020, 2 visitors to Bermuda broke the requirements pursuant to paragraph 12 of the Quarantine COVID-19 number 3 Order 2020. The individuals willfully broke their quarantine to attend a celebratory gathering prior to receiving the results of their COVID-19 arrival tests, and as provided for under paragraph 9 and 10 of the quarantine order. Both pleaded guilty to the offense, and the court made the decision to fine them $2,500 each or face 250 days in prison. Their COVID-19 tests have since returned negative results. Although it is disappointing that 2 of our visitors broke their quarantine requirements this weekend, I wish to commend the outcome of yesterday's court decision. The prosecution of those individuals demonstrates that Bermuda takes the protection of our borders and the health of our people extremely seriously. I greatly hope that further breaches will not occur and potential offenders are now dissuaded from such actions. I would also like to advise that there are 2 students and the parent of one of those students who have recently been identified as contacts of a case. With the assistance of the school nurses, the Department of Health has been in contact with those persons and have required them to quarantine. They will also be tested for COVID-19 tomorrow. The school outbreak plan is being finalized, and the Ministry of Health are arranging meetings with the school principals to discuss expectations and implementation of that plan. Along this line, I wish to remind workplaces that they must follow the return to work guidance, which can be found on coronavirus.gov.bm. Specifically, I wish to encourage employers and employees to pay particular attention to when it is safe for them to return to work following travel. This decision is based on whether you work in a high, medium, or low risk setting, and advice will be different depending on the type of workplace you have and the degree of risk it attracts. One thing that all the guidance has in common is that you absolutely cannot return to work without a negative COVID-19 arrivals test. I want to repeat that. You are breaking the law by entering your workplace without waiting for a negative arrivals test to go along with your negative pre-departure test. This means, for example, if you have a meeting the day that you land in Bermuda and you do not have a negative arrivals test, you cannot attend the meeting in person. Also, I know I have mentioned the concept of mobile quarantining before during several recent press conferences, but it is critical that travelers understand that there are certain activities you must not do until you have cleared the mobile quarantine period of 14 days post-travel. Do not attend events with large groups of people, for example, weddings, parties, or family gatherings. Do not hug or kiss. Do not visit elderly relatives or friends at high risk for COVID. Conversely, you should keep away from crowded places, stay out of closed spaces with poor ventilation, and wear a mask at all times in public places. Activities that are okay to do for travelers with a pre-departure test and a negative arrival test include things like taking a walk or bike riding outdoors, dining outside, going to the beach, swimming in a pool, hiking the railway trail, etc. However, things like going to the gym or spa are not recommended until you receive the results of your day 8 test. I know there will be many students that will be returning home to Bermuda for the holidays. Parents, please ensure that your children are following the mobile quarantine advice. Once again, I would like to encourage returning travelers to take particular care and follow enhanced precautions during the time between having their pre-departure test and boarding their flight back to Bermuda. Consider everyone you come into contact with as a potential carrier for COVID-19. Wear your mask, be extra vigilant in avoiding those who seem unwell, keep at least 6 feet distance between yourself and others, wash your hands often, carry a travel-sized bottle of hand sanitizer and use it frequently. Avoid crowds and any situations where you are unmasked with others in a poorly ventilated space. The past few days and weeks have seen 3 large sporting events take place in Bermuda, meaning we've had increased visitors to our shores. Therefore, I am encouraging any volunteers or spectators from the recent golf, sailing, or rugby events who have been in close contact with visitors or persons outside of their household, and that means within 6 feet for more than 15 minutes, I'm encouraging you to get tested for COVID-19 at one of our pop-up testing sites across the island. The November pop-up testing sites has also been posted on our website at coronavirus.gov.bm. While the Ministry of Health's testing of travelers is doing an excellent job in keeping Bermuda safe, periodic screening of the population is a good way to add another layer of protection. This is particularly pertinent when we consider that the incubation period for COVID-19 is up to 14 days. This means that some people who test negative on arrival or even on day 4 may not show up positive until their day 8 test because the virus is still incubating until that point and not detectable in their body. It is the silent incubators which requires us to maintain our defenses and highlight the importance of following mobile quarantine post-travel. And finally, the Ministry of Health wishes to remind members of the public that the flu vaccinations are available for the month of November at the Hamilton Clinic on Tuesdays, Wednesdays, and Thursdays from 2 p.m. to 4 p.m. The public are advised that this will be a walk-in service and not a drive-through like the one previously held at the Flu Express. Clients are not permitted to park in the clinic's car park. And for further information, please call 278-6460. The flu vaccine is a safe and highly effective method of preventing most cases of the flu. Stay safe, Bermuda, and remember, I wear a mask to protect you, and you wear a mask to protect me. Thank you, Premier.
Thank you very much, Minister Wilson. I am sure that the news of additional positive cases that we've had over the past week give many a reason for pause, especially with what we are seeing around the world. I would be misleading you if I said that the increase in cases did not cause me to be anxious and wonder whether or not we were moving in the right direction. Members of the public should know, and members of the public should be comforted, that we have an excellent team of professionals led by an incredibly dedicated Minister of Health and a team of amazing health workers led by the Chief Medical Officer and a team of testing staff led by Dr. Weldon, who work days, nights, and weekends to ensure we keep this country safe. There will be more cases of the virus. For a virus as contagious as the novel coronavirus, that is inevitable. For what you're seeing around the world and the fact that our borders are open, there will be more cases. We have chosen to use aggressive testing to keep our economy open and our borders open so that Bermudians can get back to work and our economy can thrive. Our strategy is working. We are 5th in the world in testing, and we have to date avoided community transmission. But it is critical that we follow the public health advice. We must all act as though persons may be infected with the virus, because if they are, and if we are acting in that fashion, we will break the chains of transmission. If we do not act and follow public health advice, that is the only way that the virus can spread. Not trying to have a science lesson, but viruses require hosts. And if a virus cannot hop from one host to another host, the virus cannot survive. So again, we are all in control of how the virus spreads. If we do what we should, it cannot spread. If you do what they have done in other countries, it will spread. It is really that simple. I have asked the Minister of National Security to ensure that there is rigorous enforcement of public health rules in business establishments, especially liquor license establishments. This means that places of business that are breaking the rules may be faced with being issued a closure notice by the Minister of Health. It is not okay to have parties in indoor spaces with persons not wearing masks. These are the types of events where if one person is asymptomatic, who may never be tested, dozens of persons can be infected from that one event and lead to an outbreak with the possibility of community transmission. Business owners, please note that you have been warned, and we must all continue to be vigilant. The government's two most important tasks are keeping the country safe and rebuilding our economy. They both go hand in hand, especially during this time. And we must remember that bad actions or a small amount of bad actors can put our economy at risk. Think about that example that I just gave with that party. One asymptomatic person spreading it to others, leading to a place of community transmission where the government will be forced to act in order to minimize transmission, putting persons' jobs and livelihoods at risk. It's not meant to sound as though this is a doomsday scenario, but our TVs are filled with what happens when you are not as diligent, when you relax. We must resist that urge. We have set an example for the world, and I am still confident in our ability to keep setting that example. We will attract more and more people to Bermuda who are drawn to our island by our track record on managing this virus, our work from Bermuda program, and the way that we promote and manage our new normal. Additionally, our traditional assets of an educated workforce, an advanced economy, natural beauty, and warm and intelligent people means that many from around the world are looking at Bermuda, perhaps for the first time. Our economic pillars of tourism and international business rely on visitors. As an example, we recently hosted international golf, sailing, and rugby matches, a tourism summit, and the 2020 Bermuda Tech Summit. As each event was either streamed or broadcast overseas, with thousands and in some cases millions of persons watching, many social media posts being generated, the opportunities were successful in showcasing Bermuda. This hopefully means that more persons over the next few months will be attracted to our shores. We are making sure that we strike that balance. But as we keep our borders open, I am incredibly confident that the Minister of Health and her now. We know how it spreads. We know how wearing masks minimizes the chance of spreading. We have been able to safely move from shelter in place to holding events of 75 people and outdoor activities for up to 800 people, as we saw last weekend. Today, we use data, arrival interviews, and innovative technology, which was piloted in Bermuda and is now being used around the world, to accurately and quickly test, trace, and make sure that people obey the quarantine rules that the Minister of Health has made. The government has and will continue to use every tool at its disposal to strike this right balance, and it is a delicate balance to strike. But as we do our part, we must all continue to make sure that we do our parts together. As you've seen, we are serious about the precautions that we have in place, and as the minister noted, visitors were fined in magistrate's court for breaking quarantine. Any breach can be a breach that starts an outbreak in Bermuda. I know that you may think that it's innocent. I know that you may think, oh, I might go to this meeting, etc. You just don't know. And if you have traveled, or if you've been in contact with someone who has traveled, that increases your risk and increases the public's risk. And that is why we're going to continue to look to enhance what it is that we're doing. But the public, at this point in time, when we have seen an increase in cases that have been reported, it is critical that we keep our guard up. Turning to the legislature, turning to Friday, the legislature will be reconvened in St. George's. And in recognition of the General Assembly being established in Bermuda in 1620. So this is the 400th anniversary. To give you a brief history refresher, one of the first laws passed in Bermuda was a conservation law in 1623, which was to protect turtles. For those who may not be aware, Bermuda's legislature is one of the oldest legislatures in the Commonwealth, and in the Western Hemisphere, second only to the Palace of Westminster in London, home to Big Ben. In Bermuda, members of the colonial parliament, as was called back then, were holding meetings 150 years before the American War of Independence in 1776. Imagine There were arguments and debates in Bermuda's assembly 150 years prior to the United States even being born. And for that, we should be proud and should celebrate our heritage. Throughout Bermuda's long history of oligarchies, suppression of voting rights for women and for Black Bermudians, there have been necessary occasions where the power of the people overturned Parliament's authority, and Bermuda is all the better for it. This pandemic has certainly impacted our economy and changed the way with how we live and work. However, the government was elected to ensure that we continue the work of rebuilding Bermuda with Bermudians at heart. Unfortunately, this year, due to the pandemic, there will be restrictions on the attendees in St. George. So I hope that you will tune in to hear the legislative plan that the government has in store for this year. Fair warning and a minor spoiler alert, this throne speech will be shorter than in years past. But that is because the government is going to lay out what we can deliver in the legislative year. Before I take questions from the media, I will reiterate a statement I made in a recent press conference. Many people in Bermuda are experiencing high levels of stress due to the impact that the pandemic has had on all of us. Many are worried about their jobs, worried about the employment of themselves or loved ones. Others are caring for family members or sharing the burdens during this difficult economic time. We are all facing levels of stress, elevated levels of stress. If you need help and need someone to talk with, please know that help is available. Take advantage of the Emotional Wellbeing Hotline at 543-1111. Again, that is 543-1111, and there will be someone there to help you. Thank you, and I will now take questions from members of the media.
Hey, Mayor, we'll start with Media Maya.
Good evening, everyone. Maya Palacio here from Media Maya. One of my questions actually pertains to last week. There was a press release about biometrics in the UK, and my question would most likely go to the Minister of Labour, but he's not here. Would biometrics still be something that the government is trying to get a Canadian representative to come down for students looking for student visas for Canada?
I'm really sorry, Maya. I think that the Minister of Labor did answer this question before, and I don't actually remember the answer for it, even though I think I was at the press conference, which is unfortunate. But do you remember, Kim? I'm sorry. It was, Aranka may have the answer, and we might try to get that, but I know that there was something. However, I don't know when Canada is letting students back in the country, because I know that students who are in school in Canada were not able to go back, so I'm uncertain when they're letting students back to the country. But we'll try to get that information. You send it in, we can look to get that answer.
Okay, thank you. My next was for Minister of Labour as well. Was pertaining to the closed category jobs that were mentioned. My question was, what were the specifics in picking those jobs? Like, what made you pick those precise ones for the closed category?
I'm happy for the Minister of Labor to answer that question. If you pose that question to him in writing, he will. But what I will say on a broad and general term, as I think the Minister of Labor has stated, that we have a severe issue with unemployment in our economy due to the pandemic. Those job categories, which many of them were closed already, some of them have been added to the closed category listing, are for new work permits. So they're not for renewals. So there is a balance that is being struck. But as the minister said, that renewals for positions where Bermudians are available for those work will certainly be scrutinized, as we have to make sure that we provide employment in Bermuda as best as possible. But I think what the minister also said is that he's going to strike that balance. But I would expect that he would have had the research, the knowledge, and understanding of the various positions that were there, the volume of permit applications which may or may not be coming in, and taking into account of the types of persons who may now be out of work due to the fact of closures of large hotels and layoffs in other places.
Thank you. And my next question, being that the recent level or number of positives have increased in Bermuda, and you mentioned about businesses being more vigilant about the requirements. Will the regiment or persons in police force be like doing visits to different establishments like they were prior in the beginning of COVID again?
I'll answer that question, and then I'll hand over to the Minister of Health if she wants to answer it. Enforcement falls to the Minister of National Security. The Minister of National Security works alongside with the Ministry of Health. There is certainly enforcement activity that is taking place. There's enforcement activity that takes place every weekend with the Bermuda Police Service. There's enforcement activity that takes place with the Ministry of Health's officers, with establishments that they regulate. At our meeting earlier today, I know that the Minister of National Security reported that there were public health violations that were reported in an establishment over the weekend, and those matters will be forwarded over for action. We are taking these things incredibly serious. So the enforcement activities continue. I do not know if there is a view to re-embody the regiment, but the Minister of National Security is certainly continuing to work on the matters of enforcement, and I think that her team is going to continue to do the job which is necessary to remind establishments that they have to abide by public health rules or guidelines, or they will face closure notice. We have to be serious, and if we're going to find visitors, we also have to remember that business owners have a responsibility to act, and it's irresponsible of business owners and irresponsible of employees of businesses to allow their establishment to break the rules. And here's the reason why. One of two things that can happen. One is that you can be found for violating the rules, and your business can be issued a closure notice. The worst thing that can happen is that you can violate the rules and have an outbreak where the business is required to close, and that there's other challenges, and persons there are required to be quarantined, and then persons who are there are quarantined then cannot work. That's the challenge of which is being faced. So it's important that these guidelines are followed. Minister, do you wish anything to add?
No, that's fine.
My question for you, actually, Minister of Health, would be, I definitely missed this press conference, but a mentioning of traveling for Bermudians and the requirements that we should be taking as to if we wanted to go away to just have a holiday or vacation, what are those stipulations?
Okay, I almost jumped out of my seat, so forgive me. We have said, thank you for that question. It's really, really an important question, and I want to emphasize as much as possible that we are strongly dissuading and discouraging persons from going overseas. We are in the midst of a pandemic, and unless you have to travel for essential things such as medical purposes or returning children to school, to go away on a holiday should not be something that a person should be considering right now because of the pandemic. In the event that you must travel because of essential reasons, upon your return to Bermuda, you obviously will be tested through our aggressive testing regime, but we are also encouraging persons to exercise caution and to remember the requirements as it relates to mobile quarantine. The incubation period for COVID-19 is 14 days, so you could very well come home and have a pre-arrival test, or you could and test negative. You could test on arrival. You could test negative on day 4, and then test positive on day 8. So it's really, really important for everyone to remember the public health guidelines, and particularly the 3 C's: avoid close contact, avoid closed spaces, and avoid. No, nobody's listening. What's the 3rd C? Close contact. Oh my goodness.
Close contact.
Crowded places. Thank you. So that's incredibly important. So I think if I can just end by repeating myself, that the government is strongly discouraging any travel during this time unless it's essential.
Okay, thank you very much.
Maya, if I can just add to that, I know that there is a significant amount of, criticism or noise around the government urging people not to travel. Here's my thing. People are like, oh, a staycation isn't the same. Here's my advice for a staycation. Go to one of our nice, wonderful resorts and leave your mobile phone at home, and you will feel as though if you traveled to a planet far, far away because you don't have your mobile phone or the internet, and you become at peace and relax. And I think it's very serious. And it's difficult to understate. We want to make sure, and a lot of persons are saying, well, we're inviting tourists into the country, all the rest. It's a difficult balance that we have to strike. And the fact is that the government needs to support persons to work. But if we have residents who do travel overseas, who do come back, who bring additional virus into the country, and we somehow unfortunately have an outbreak, if we have one, that will put everyone's jobs at risk. So I know that it's difficult, but we have to remember during the shelter in place and other times, we sacrifice. And it's along this same line here. It's about the sacrifice which is necessary in order to keep the country safe. So we advise persons to avoid traveling if at all possible.
Thank you very much.
Walter Beck.
Thank you. Good evening. Minister of Health, I was looking today, and on October 5th, we had 2 active cases, and I think the joke going around Bermuda is that we had fewer cases than the White House. I don't know if that's still the case, but we had 2 active cases. We've now got 21. I wonder if those numbers continue to escalate, whether there's any thought given to the fact that we may have to roll back stages as other jurisdictions have done. I'm just wondering if that's being considered.
Thank you, Duncan. If we get to a point where we have community transmission with unknown sources, right now all of our sources we know are traceable because they're all imported. But if we got to a position where we had widespread community transmission and unknown sources, then we would certainly have to reassess where we are insofar as the existing luxury, so to speak, that exists right now. So certainly those are discussions that we're having within the ministry insofar as if in the event that we get to those places, what type of activity will be rolled back, such as restricting the size of gatherings or encouraging restaurants to only have, or requiring restaurants to only have outdoor dining versus indoor dining. Those are factors that are being discussed as I'm speaking, so to speak. But our hope is not to get there, and I think a lot of that can be avoided. We recognize that we're seeing second waves throughout the world, so the reality is because our borders are open, we are likely to encounter persons coming from those jurisdictions that may be positive. However, we have such an aggressive testing regime, we are likely to catch those persons upon arrival or certainly within their subsequent test day 4 or day 8 testing. So our regime is quite regimented insofar as the testing, and we'll continue that. But the reality is, we are living in a global pandemic, and as long as our borders are open and remain open, and as the Premier indicated, there's a lot of reasons why that is the case, because we need to keep our economy afloat. We will continue to do our aggressive testing so that we can best protect Bermuda as a whole with respect to the incoming visitors that are coming from countries that have a second wave.
Just to add on to what the minister said, it's critical that we remember that we're in a different place now than we were in April. So there's addition, of course, with technology that we have. There's an addition with the resources of which we have and the understanding of the virus. But the fact that the minister noted, which is the most important point, we by and large know who has the virus on our shores. And we have been very good, and her team, and I just want to give another shout out to the Minister of Health, her team, the chief medical officer, the nurse epidemiologist, all the team inside the Ministry of Health, the testing team, for all the work which they're doing, managing this. And I know that they have meetings on weekends, meetings late in the evening, especially when the cases begin to rise, to make sure they track down every single case and to make sure they are continuing to reach out in these aspects and instances. But it's a different circumstance, a different situation. But the most critical point is, if there is an asymptomatic case that is running around, it is all of our responsibilities to make sure that we have these public health guidelines, we adhere to them to make sure that we don't have an uncontrolled outbreak. Because if we have an uncontrolled outbreak, as the minister said, what is the challenge is if there are multiple unknown sources of transmission, that's when we have a problem, and that's when we have to consider the rollbacks.
This question came from a sharp-eyed reader who said that what she's noticed is a number of tests coming back on day 4. So you have a pre-departure test, that's negative. You have an arrivals test, then given within 24 hours that test comes back negative, then you're allowed to go out. And what she's noticed is, recently, and I think there were 4 the other day, positive tests on day 4, and she wonders whether there should be additional restrictions either on movement or where you can dine, maybe only outside. And I wonder if there's any thought, as you see those cases grow a little bit, as we've seen lately, whether those kinds of additional restrictions are being considered.
Those that reader's comments are very well warranted. That's why, and again, you're giving me an opportunity to make a shout out again for the necessity of us adhering to the mobile quarantine provisions. The incubation period is 14 days, so it is not uncommon for someone to be in those circumstances, Duncan, that you've just explained, and test positive on a day 4 or a day 8. However, again, emphasizing the importance of mobile quarantining. I went through a number of items just a few moments ago, but the essence of mobile quarantine is to continue adhering to the public health guidance, avoid the closed-in spaces, avoid close contact, make sure that you are within 6 feet away of people, make sure you wear your mask, public health guidance as it relates to washing your hands, etc. I know it sounds like a broken record, but if the incubation period is 14 days and you have just traveled from abroad, and we recognize that the majority of our travelers are coming from the places that are having second waves, then we need to ensure that persons adhere to those guidelines, particularly as it relates to the mobile quarantine. There's a lot of things that you can do that don't necessarily require you to be in close contact with individuals, as well as being enclosed in spaces and crowded spaces. So it's all with respect to the mobile quarantine, and we're encouraging everyone that is a traveler to adhere to that, because as you said, a person tests positive on day 4, and if they're adhering to the mobile quarantine, then the likelihood is that there'll be less transmission. And likewise, we also have a responsibility to make sure that we adhere to public health guidance and make sure that we stay 6 feet apart from people as much as possible and avoid close contact and so forth.
Okay, thank you. Question for the Premier. Mr. Kimitsiong held a press conference today, as you likely know, and he spoke about his matter and his resignation and so on. And he said today that he's convinced that you knew about the situation with the civil servant as it unfolded, and I wonder what your response is to that, to say that you knew about it sometime before, or as it happened.
Unfortunately, I had a cabinet meeting today, and to this date, or this minute, I still have not had the benefit of looking at the entirety of Mr. Kimitsiong's statement, or his, I guess it was a press conference. However, let me state for the record my statement on this matter, because I have been provided with some excerpts. Let me be clear. Rolf's letter was released with his full knowledge. We met that day for a considerable time to deal with what were incredibly difficult circumstances. One of the reasons for the extended time of our meeting was because of the prolonged discussions on the precise language of his letter, which would be released publicly. There is nothing to be gained from rehashing these issues. My position, which I made clear at the time, is that I was compelled to act based on new information that had come to my attention. The firm stance I took on these matters is a reflection of the seriousness with which I personally, and the government in particular, view the importance of the respectful treatment of women. I wish Mr. Kimitsiong and his family the very best, while this government will remain focused on delivering economic recovery, education reform, a living wage, and working to protect Bermuda from a second wave of the coronavirus.
One of the things that he claimed today is, in fact, he didn't write his letter of resignation, that you wrote it, and that he was coerced into signing it. I wonder if you can speak to whether he wrote the letter of resignation or whether, in fact, you did.
I think that my statement lays it out very clearly, and there'll be no further comment on that.
There's a lot of talk in government circles here and elsewhere about the importance of transparency. And we're at a press conference and we're asking questions of I think, importance. Why is it that you won't comment further when someone who is a former government minister has come out with strong statements today?
Individuals can make many different statements. As the leader of the country, I'm not going to be drawn into different back and forths, and I'm going to remain focused on the work of which is necessary for the country, for the government to be engaged in. And so the fact that I haven't even had the benefit of reading the entirety of the statement is because I was busy in a cabinet meeting doing work and making sure I prepared for a press conference so that I can answer the questions on behalf of the media.
Okay.
CNN?
Good evening. Looks like work is still my thunder, but we'll moving right along.
That's why you were so upset that someone got to go in front of you, Trevor.
Yes, sir. Minister of Health, this one is for you. The two visitors you've just spoke about them being identified. My question is, how were they monitored? Were they identified by your healthcare workers or members of the public at this particular ceremony?
As I understand it, upon their arrival, they were informed by the port health nurses that they were required, as is our law, as is the case for everyone that arrives in Bermuda, to remain in quarantine at their residence and/or hotel facility until such time as they receive their arrival test. The legislation indicates that it will be obtained within 48 hours. However, oftentimes we know that it's normally within 24 hours. Oftentimes people go to bed and then some hour in the morning they receive it, and then when they wake up they have it. So that was the requirement. Those were the instructions that were provided when the port health nurses attempted to speak to them at their accommodations, because when you provide the information on the TA, you have to list where you're staying. When they contacted the hotel accommodations, they were informed by their staff that those persons had left their facility. And then the team went to where they understood them to be, and there they were, and engaging and mingling in activities with other members of the public that were at the same event. No mask wearing, but the rest was obviously a part of the public record that was revealed in the court case yesterday.
Good stuff. Hats off to this.
Beg your pardon?
Hats off. Good stuff. Hats off to this healthcare workers.
Yes.
My next question, how many people or persons are arriving in Bermuda on a daily basis? That way, and with my second part of that same question, how are these persons being monitored? So they're getting tests, they're checking into facilities. Who's monitoring these individuals coming in before the test, the results come in?
When the persons arrive in Bermuda, and whilst they're waiting for their results of their test, similar to the case that we just spoke about, the public health nurses will contact them. There may be cases where they're not contacted, but in all honesty, the great thing about it is that most people want to adhere to the public health guidelines. So then when they enter Bermuda and they see big and bold on the information that's provided to them that failure to comply with the quarantine acts can result in a fine of up to $25,000 and/or 6 months imprisonment, most people abide by that. So this particular case, though it's unfortunate, you would appreciate that it's extremely rare as well.
Thank you. Although Maya had asked questions about for the immigration minister, and I know he's not here, but Premier, I want to ask you: are you aware that there are still persons that are here without work permits and have evaded authorities on these matters? They have not left, and is the immigration officers aware of these individuals, and how are they going to be tracked down?
Trevor, the answer to your first question is no, I am not aware. The answer to the second question is no, I cannot say whether or not immigration officers are aware. The third thing I would say is that the Department of Immigration has a hotline that any member can call. I'm uncertain if individuals will be able to put it on the screen here, but I'm happy to try to get it up on my social media this evening. And persons can report those violations, and I'm reasonably confident that the Department of Immigration and the Enforcement Office and the enforcement team will follow up on those. And if there is not matters that are being followed up on and members of the public have information, feel free to contact that number so that persons can understand precisely what's taking place.
Thank you. My last question, and this for you. After you review the press release from Mr. Commission today, are you going to have a press meeting so we can bring forth some more questions?
Actually, no, I don't believe so. I mean, you are welcome to ask as many questions as you wish for the matter. The matter is closed. A new senator and minister will be appointed in due course, and I'm going to be moving forward on this matter. Persons may wish to rehash this, but I would hope that persons would remember that every time that they rehash this matter, there are victims in this case, and there are victims who I have read their personal testimony and understand the challenges of which those persons have had. So I'm not going to discuss this matter out of respect for them.
Okay, but TNN was the one that posed those questions to you from day one, and you stated you were not aware of this first two matters, not this third matter, the first two. And Mr. Commission said that today in his statement that you were aware of those matters. That means that he was stating in his words that you lied about the whole matter.
Well, given the fact that Mr. Commission's no longer a minister because of the matters which was stated very clearly inside of his letter about not providing full and truthful answers, I'll just leave that there.
To be continued. Thank you very much, sir.
No problem.
Bermuda Broadcasting.
Good evening, Don Burgess, Bermuda Broadcasting. The UK will go into a second lockdown on Thursday, scheduled to go through December 2nd. Much like March and April, we are hearing of Bermuda parents rushing to bring their children home from the UK. My first question with regard to this is, are we looking to get our children home again?
The answer to the question is if persons want to fly home, they're more than welcome to do so.
Okay. The second part is...
As long as they, of course, obey the Minister of Health's quarantine requirements, everything will be fine.
What discussions has the government had with British Airways about its flight schedule during this time frame?
We haven't had any specific discussions with British Airways. The advice from the United Kingdom government is to only travel if you're legally permitted to do so for the purposes of work. As such, some carriers have reduced their schedules. We have not seen any indication that British Airways will halt any flights to Bermuda, and they may change their schedule, but once we are notified of that, we'll be sure to let the public know if there's any change in the British Airways schedule.
Okay, thank you. This month, there's pop-up testing available in 4 locations, but there are none locations in the city. Most of the pop-up tests are available in St. David's, Shelley Bay, Somerset, but the majority of the workforce is still in Hamilton. Premier, you recently were able to use Perot's post office facility. With a rise in cases in Bermuda, why isn't there a regular pop-up testing option available in Hamilton anymore, and can this be brought back?
Don, we are testing for COVID 5 out of 7 days a week. And there are, as you indicated, a number of locations in which the pop-up testing sites occur. Special thanks to Marketplace stores who are allowing us to use their facilities at the Somerset Marketplace, Herring Bay Marketplace, Paget Marketplace.
Shelley Bay.
And Shelley Bay, thank you. Paget is just outside of Hamilton, so it's not far of a drive for persons if they're in the Hamilton area and wish to get tested there. 5 days out of 7 days a week, I think, is quite sufficient for our testing regime.
Okay, thank you. The International Olympic Committee, President Dr. Thomas Bach, praised Bermuda's successful efforts to safely host 3 international sporting events, which you've mentioned tonight. It has been suggested that Bermuda could be a model for the world to follow, especially as Tokyo is getting ready to host the Olympics next year. What can the world learn from Bermuda's success in recent months?
We have to thank Dr. Bach for his assessments and, in fact, his positive indictment on Bermuda and our testing regime. Speaking of the testing regime, I think with the aggressive testing that we have, coupled with our use of technology, such as with the Aqua Watch and so forth, those are 2 examples that I think other countries could perhaps follow with respect to trying to keep their borders safe as well as being open at the same time for economic gain. It's also important to note that those particular events that have come to Bermuda that we've spoken about recently, and I know that there's some more that are coming, some other types of international sporting events. You know, they do speak to us in advance, so we're able to provide them with clear instructions as to what our expectations are regarding the public health guidelines and what needs to be followed, particularly as it relates to testing. So it's about a communication aspect as well as utilizing aggressive testing and
Children's lab at Bermuda College be up and running?
answer to that question is when it is completed being constructed. The work of testing continues at the MDL lab at its undisclosed location. The Ministry of Public Works and the Ministry of Education are continuing to work through the need or the specifics to make sure we get it done properly and correctly. And we're happy to provide updates when there's concrete updates to certainly provide. They are working through that situation as we speak, and we're certain that there will be a lab that will be built and set up, which will allow students at Bermuda College to learn and get hands-on experience with laboratory science while we continue to test here in Bermuda.
Thank you. My last question is with regard to naming a new senator. Why is it taking 3 weeks to name a person to fill that post?
Because of no particular rush, I would say. One doesn't have to be named until the convening of Parliament, and I've been deliberate in my process. And so one will be named, as I'm expecting, to go to Government House on Thursday.
Thank you very much.
Premier, there are no further questions?
Thank you very much. One thing that I would like to say in response to you, Mr. Trevor Lindsay, is that if persons would like to call the immigration hotline, that phone number is 296-5202. That number again, Trevor, is 296-5202. Whomever has these immigration violations, please ask them, and please ask your readers to use 296-5202 if they wish to report said violations. And I'm quite certain that the Department of Immigration and the persons there will follow up with that. Thank you all very much for watching. Thank you, members of the media, for your attendance. As stated earlier, on Friday will be the convening of the legislature and the throne speech for this legislative session. Also, the swearing in, of course, of new members of the House of Assembly and new members of the Senate. I'm sure it'll be covered on all government channels as well as local channels as well. And the Minister of Health and I will be back with you next Tuesday evening for a further update on matters relating to the coronavirus. Please, Bermuda, continue to follow the public health guidelines, as it is urgent and essential for us as a country to remain safe. With that, thank you, Bermuda, and good